special red socks for you so you can see my feet against this busy design carpet, because we're going to be moving around a lot with our legs, so I wanted you to be able to see my feet. So before we get started, I thought we would try a few of the moves together, and so you know what I'm referencing when we go through our song, through our dance. So first of all, I want you to get your snappers out. Sometimes we can't make noise with those hands, but do your best. Get your snaps. We're going to be swinging from side to side along to the rhythm. And next, we're going to take a march. Yes? So hopefully we're all getting out for walks these days during our quarantine. So I want you to get your knees up as high as you can. And if you can swing those arms, that's even better. Awesome. Okay, from here, I call them toe pats. So I'm going to replicate what my feet are doing with my hands. So I'm lifting my toes and dropping my toes down like this, and I can alternate them. Good. Now, heel drops. It's the opposite. So my heels are actually dropping down, and I can alternate them. I can go at the same time. Good. Now, I want you to really stick one leg out, far out in front of you, heel dropped on the floor, and bring it back. Other side. Reach and back. And reach. You see how high I'm getting my knees? That's it. Good. Now, same idea, but to the side. I'm going to stretch my leg out to the side, and to make it fancier, I can even use my arm in the same direction. Back home. Side. Back home. Good job. Nice work. Good. And then we're going to do some ankle mobility. So I'm going to lift my leg from underneath, and I'm going to circle my ankles in each direction. So those are the basic moves. Hopefully, you're all able to do this with me at home. The song is called Sunny Side of the Street. We're going to be looking more optimistically in life. And so that's what I thought would be a fun theme and a fun song to dance to today. So let me get my speaker ready, and then we'll dance together. Okay, here we go, everybody. Sitting nice and firmly in your chair, feet in front of you, firmly planted into the floor. You might need to scoot your bottom a little bit forward into the chair to do so. And then let's get started. Here we go. All right, snapping from side to side, feeling the rhythm, side to side. Good, do it again. Yes, feel the swing. Now, let's march in place. High knees. High knees. Get those arms moving. Good job. All right, toe pats. Alternate. One, then the other. Back and forth. 5, 6. Good. Now, both at the same time, double time. Nice and fast. Good. Feel that rhythm. Now the heels alternate. Nice and slow. Heel. Heel. One at a time. That's it. Now go fast. Go. 1. Heel, heel, heel. Very good. Stretching one leg forward. Here we go. Stretch. Out. Each side. Go. Now to the side. Reach it out. And out. Good. Good. Now little jumps from side to side. That's it. Like Fred Astaire. Good. Front and back. And back. Front and back. Front. Nice work. Lifting one leg. Finding those ankle circles as big as you can make them in one direction. Good. Let's go the other way. Big circles with those toes all the way around. Other leg. Here we go. Lift it up. Nice and easy. Get those feet out. And reverse. Other way. All right. Good. Put that down. Reach the heels forward. Again. 4 times. This is 3 and 4. Now to the side. Go. Stretch. How far can you reach? Very good. All right. Little jumps. Here we go. Back and forth. On your tippy toes. That's it. Now front and back. Go. Front and back. That's it. All right, we're gonna snap from side to side like the beginning. Find the rhythm. That's it. Good. Now we're gonna do a big pose to finish. Woo! Good job. Yeah, I wish I could have seen you all. I could only see some of the panelists moving. So anyway, I hope got your heart rate going. Maybe put a smile on your face. Good job, everybody. Thank you, Shannon. That was wonderful. So we can't see you out there dancing, but you do have that little raise hand feature. I think it's in the upper left-hand corner. So if you click that, who danced along? Okay, I see Maria and Judy. Nice. And let's see who else was dancing along. Colin was dancing along. And you guys feel better, right? So Shannon and I co-facilitate events in person in real world when we're not in these crazy times. And Shannon's always telling me not to be a brain on a stick, which I tend to be, to get the body into it, because what we do with our bodies affects our brain and vice versa. So thank you, Shannon, for that. That was fun. And Sherrie, I think we're ready for your next set of slides. Yeah, you have good dance moves too. I like watching you on top of the mountain dancing.
Shannon, you're the best. Seriously, oh my gosh, you're amazing. So fun. You did a great job. And exactly what we needed in between these two kind of heavy duty talks, everybody. So the next thing we're going to talk about are really behavioral challenges. And this is another side of Parkinson's that we do not see. So our objectives in this part of the talk. So what are the behavioral challenges that we so often see in Parkinson's disease? And those are things, not just Parkinson's disease psychosis. And thank you guys for some amazing questions. And thanks for your honesty of just coming out, and so many people out there that need help. But anyway, anxiety, depression, impulse control problems, as well as apathy in Parkinson's. And we're going to talk about why are they so prevalent? Why do we see these so often? And pertinent to today, how is COVID-19 throwing gas on the fire? There's already a fire. There's already these non-motor symptoms of Parkinson's that are, as we know, more distressing than the motor symptoms. And COVID-19 on top of it? Are you kidding me? Very difficult. So we're going to talk not just about why it's made it worse, but I'm going to give you some strategies towards the end of this talk of what you can do even while sheltering at home. And so we know that mood disorders, not just the Parkinson's disease psychosis, but we're talking, when we put all of these mood disorders together, literally 70 to 80% of patients with Parkinson's are going to suffer from one of these type of behavioral/mood disorders. And they are incredibly difficult to deal with. And they're the most worrisome for the patient and for care partners and for the adult children of people with Parkinson's. Very difficult to deal with. And on top of that, the pandemic is affecting all of us, not just you with Parkinson's. It is affecting us all. A blanket across the world has fallen, and all of us are dealing with way more anxiety and depression than we've ever experienced before. So what causes these mood issues? Why do people with Parkinson's have these kind of mood issues? Well, guess what? Many of the same reasons why you have these issues with motor, the slowness, the rigidity, the little handwriting, the loss of smell, the slowness, loss of neurotransmitters, right? The same processes are causing the mood issues. There's such an alteration of different neurotransmitters. And, people think about Parkinson's and they think about one thing, right? They think dopamine. Well, dopamine indeed is a big culprit of the problems we have in Parkinson's, but there's a host of other neurotransmitters that are out of whack. They're out of balance, including things like serotonin that we've chatted about, acetylcholine, glutamate. There's just a bunch of them. And so the brain works very hard to compensate for this loss and abnormality of all these neurotransmitters. But we know that the frontal lobe in particular, when there is in Parkinson's some atrophy, some shrinking basically of this frontal lobe of the brain, as well as loss of dopamine, we know for a fact that that definitely relates to depression and apathy in Parkinson's. And we know that loss of dopamine in the basal ganglia, kind of that whole middle part of your brain that we look at in Parkinson's, that's deep in, at one point was very rich in dopamine neurons. We know that as that loses dopamine, that is strongly related to anxiety. And then there's the specific receptor sites on the serotonin neuron that we know get basically hyperstimulated, causing those hallucinations and delusions we just spent some time talking about. And hallucinations and delusions also are compounded by the hypometabolism in the posterior brain regions that also are adding to this problem. And then we know there's neurotransmitter problems, but then there's the diagnosis itself, the reaction to the diagnosis, which is pretty darn huge. To get a diagnosis of Parkinson's disease kind of is a game changer. It's frightening and it's scary, and it can definitely add to anxiety and depression. And it can change interpersonal relationships, and all sorts of things can go with that, like disability and all the psychosocial factors that can happen. And then there, of course, is again the interaction between the disease process itself and the dopaminergic therapy that we need to treat your motor symptoms. Kind of double-edged sword in some respects. So now let's delve a little bit more into each one of these mood disorders, and let's take a look. What does it look like in a person with Parkinson's disease? Well, first of all, anxiety is probably one of the most common mood disorders in Parkinson's disease. Again, up there with PDP, more than 50% of people with Parkinson's will suffer from anxiety, some kind of anxiety disorder in their lifetime. And we know, again, as we just talked about, that a lot of this is due to a decrease of both dopamine and serotonin, causing these anxious feelings. There's also anxiety, not just in our brain, but oftentimes patients will talk to me about kind of an internal angst. It's like in their gut, it's in their bellies, it's somewhere here, and it's just uncomfortable. It's just like, oh, gotta move, I'm just not comfortable. One of my patients describes it as the heebie-jeebies. That's what he describes that. He just gets the heebie-jeebies. And a lot of that is because, guess what? Dopamine neurons don't just exist in our brain. They exist in our gut as well. And so when dopamine levels change and are altered, our gut feels that anxiety as well, creating that sense of angst. So what does that anxiety what does it look like in a person with Parkinson's? Not just what does it feel like, what does it look like? And it is excessive worry, and it's out of character with how that person was years before they got Parkinson's. That wasn't that old person. They weren't really a very anxious, worried person. And they can feel worried really without reason. It just kind of can happen in the middle of the night. Patients have talked to me about that, you know, they wake up and their heart is beating and they're breathing hard and something's going on, and they're just full of anxiety for what they see as no reason at all. And sometimes that looks like their chest can get tight, their difficulty breathing, maybe some shortness of breath. They're feeling sad, hopeless, withdrawn, that anxiety type of thing. Doesn't want to make them not be in social situations. Well, that's certainly cured right now with COVID-19, but in normal situations, it really does impact a person's social life, It also affects sleep and their weight and decreases focus. And then it can actually, as anxiety increases, it can actually create a panicky feeling. And so you get this like cyclical situation that goes on, that one thing leads to another. So it may start with a little anxiety, but that little anxiety leads to some shallow breathing. So you're shallow breathing, and when you breathe so shallow, then your muscles get a little tight, they get a little tense. And then with that, you have more shortness of breath. And then with that shortness of breath, because you're not really oxygenating correctly, you get tired from that tightness in your muscles, that shortness of breath. You have less energy. All of those things then create more anxiety, and more anxiety creates more shortness of breath. And you can see where I'm going with this, that things can just get out of hand and get worse and worse. And Parkinson's actually really can be intense. I'm not saying it always is, but it can be intense, and people do worry about a lot of things in Parkinson's. I mean, they worry about their future. They worry about being a burden to society, to their family, to their care partners, to their children, young or old. They worry about cognitive decline. Will they be able to keep working? Will you be able to do the things that you did before? On top of that, there's the physical worries about balance. You know, will I be able to maintain my balance? What if I fall? What if I break a hip? What if I end up in the hospital, heaven forbid? And then, of course, everybody across the board is worried about the pandemic, about COVID-19, and about their susceptibility, especially with Parkinson's disease, that we know any long-term disease increases susceptibility of long-term complications and worse outcomes if one does get the virus. And then there's depression in Parkinson's disease. So as you can see here, the blue indicates post-diagnosis of PD, and the red indicates pre-diagnosis. So you can see there's issues with depression really years before people get a diagnosis. And we know that because we know Parkinson's starts a good 20 years, maybe longer, before you ever got that diagnosis. You start losing those dopamine neurons in your gut, in your brain. You start losing serotonin. You start losing acetylcholine years and years before you get a diagnosis. But at diagnosis, wow, look at how that spikes in terms of level of depression with all the worry of Parkinson's. So we define depression as really a sad mood, a loss of pleasure and interest, and just a lot of difficulty performing activities of daily living. The most simple of things become incredibly trying. Things like just get dressed. You know, do I really need to shave? You know, I've got this 3-day shadow that's getting out of hand, but I'm just don't have the energy. I'm just don't have the oomph to get up and go, to go ahead and get that razor out and shave my face, getting bills done, getting that list of to-dos done. And when we see this lasting 2 weeks or more, it is indeed a clinical depression. And then we look at Parkinson's disease, and then we look at depression, and we look at this short list. This is not at all inclusive. I just picked out a few things, but the irony is we can go through these and we can look at it through the eyes of a person with Parkinson's, and we can go, oh, that really applies. Problems with sleeping. My appetite definitely has changed. I'm definitely slower. I definitely don't have the libido I used to have, and I know I'm starting to develop some of that, you know, facial masking they talk about. I'm not really feeling so much like I want to be with my friends for a variety of reasons, from speech to anxiety to depression. And God, my concentration just isn't as good now as it used to be. But look at the same list in terms of depression. These are similar to people that don't have Parkinson's. They're going to complain about similar symptoms as the ones we just talked about. So there really is an overlap between both of these. And then there's apathy. And apathy is different from depression. And it's characterized by a lack of initiative and motivation. So your brain is basically telling you, get up and get that done. But your body is not listening. your brain's like, come on, I know I've got this list, let's get it done. And it's just not working. The brain no longer is telling the person, you must get it done. You should get it done, but you don't have to, is the way your brain is thinking. And you just don't have the drive that you used to have. That inability to act and to initiate activity is the hallmark of apathy. But this is the difference with apathy. And I want everyone to listen to this, because this is a little bright moment here. And that is that once you actually engage in that activity, guess what? It's enjoyable. You have the energy to do it. You enjoy what you're doing. It's fun. It feels good to get that thing on your list done. So that differs from depression. And then there's impulse control issues. And those are defined as repetitive behaviors that are oftentimes problematic for the individual as well as for the family. And impulse control issues can come in a variety of flavors. There can be compulsivity and surrounding everything from gambling, pornography, excessive anything, too much shopping, too much cleaning. I talked to a patient's husband on Monday who he told me that not, thank goodness, not every night, but at once or twice a week, his wife of many years would get out of the bed at 2 o'clock in the morning and obsessively clean. Be on her hands and knees, cleaning the floor, cleaning the cabinets that she had just cleaned the week before, just doing it compulsively and obsessively. These are all impulse control issues that are very bothersome to both the patient and to their loved ones. Again, we want to look at that medication list. We want to make sure that they are not on a drug, whether it's for Parkinson's or not, that is exacerbating that issue. And then we talk about COVID-19, fuel on the fire. So all of us are feeling this. There's that sense of fear and anxiety, not knowing what's going to happen in the future, not knowing when society is actually going to open again, not knowing when a normal trip to the grocery store can maybe be what we just kind of do in our weekly events, getting together with friends. And we talk about absence of privacy, even going to rock steady, with all your buddies and having that time, or you're just shooting the breeze with people that are in your gym or your exercise class or your rock steady boxing class. That's been shut down. So that type of social connectivity has been stopped during COVID-19. And we as humans, we need physical contact. There have been more than 10 huge studies that have proven beyond the shadow of a doubt that human beings need physical contact. And that's been taken away from us with COVID-19. That hugging, the grandkids or our family or our brothers and sisters or our friends that come over for dinner and we give them the biggest fat hug when they walk in that door. Definitely on hold for a while. And it's been tough for everybody. Financial realities are difficult for everyone, whether it's losing a job or being afraid to look at your 401k or your retirement account that was invested in stocks. And what are you going to do now about that? And hugely, separation from your tribe means a heck of a lot decreased support. All those peeps around you that are your tribe, that get you going, expect you to be there at Rock Steady Boxing, to be at the gym, to meet them for that walk. It's definitely fuel on the fire right now. So now the good news, most anxiety and depressive orders in Parkinson's can actually be pretty successfully treated with a combination of medications and behavioral therapies. Thank goodness. Psychological services, I cannot stress how underutilized they are and how important they are. Medicare pays for psychological services for some counseling. I mean, you need to find a psychologist that actually takes Medicare. And I'm going to give you a website that's fabulous for finding that right in your geographic area. But it is phenomenal to talk to a counselor via telemed or in person. So they don't really need to live in your geographic area actually anymore. And reach out and get some of those problems figured out. And they really can help with recovery. They can really reduce recurrence of intense anxiety and depression. And best of all, they can give you tools to put in the toolbox. They can give you ways that you can learn to cope with your anxiety, your depression, and your apathy. So reach out and get a good counselor. Remember, and nothing can be emphasized more than exercise. Exercise is medicine. There's absolutely no doubt. There is a plethora of studies. You can see 2 here on the screen that you can just read, but they all point to so much of the same thing. No matter how many times we do them, late, early Parkinson's, doesn't matter. Exercise and Parkinson's is a beautiful marriage. We know that it improves cognition. We know that it improves mood, which is what exactly we're talking about today. We know for a fact, and through a plethora of research studies, that improves gait and executive function, thinking, doing things, being able to plan your day, balance your checkbook possibly, plan a trip. And we also know that exercise that links mental and physical together is like the best. It's the best. It's like the example I give is when you're walking in this day of COVID and you're walking close to your partner, because you can, outside, distancing from others, obviously, and that partner of yours, that care partner, or whomever it may be, that you can walk safely with, is reminding you about keeping your shoulders back, and you're allowing them and not looking at them like they're nagging. Keep your chin up. Keep your chest out. Make sure you take long stride lengths. Are you swinging your arms? Are you walking out? Are you really working that walk so all your body is exercising and you're listening and you're performing what they're reminding you to do and you're exercising? Nothing could be better than that for your brain and for your body. And lastly, about COVID, I want to just put in a plug that during COVID-19, you wouldn't for a second think about stopping your Parkinson's meds. So I want you for sure to never stop thinking about getting creative and just thinking about stopping your exercise. They both have to continue, your medicine and your exercise, in whatever way it can. So antidepressants, they really work. There's a big study done out of University of Rochester, and what they did was they looked at 2 of our SSRIs, Paxil and Effexor, as compared to placebo in patients with Parkinson's. And they saw 50% improvement from anxiety and depression in particular on the patients that were on the real drug of either Paxil or Effexor. So these are 2 drugs that work very well for treatment of these mood symptoms in Parkinson's. Like Nuplazid, antidepressants they're not a magic pill. They do not work overnight. You have to be patient. You have to take these for 4 to 6 weeks in order for them to work. Do not think if they don't work in 1 week that it's okay to stop them, because they're not going to work in a week. 4 to 6 weeks, please be patient, but they do work. So specific suggestions during the pandemic, go ahead and label your feelings. It's okay for all of us to talk about and feel unsettled in the grocery store, and it's okay to walk way out on the sidewalk or on the street when you're outside, catching in that fresh air and breathing in that fresh air and walking 6 feet, keeping that distance from others that are walking towards you. And it's okay to acknowledge that we're all scared of the unknown. We're all worried about our finances and our future and how long it will be before we retired, because our retirement funds have shrunk or our jobs have been lost. So label your feelings. It is okay to do that. And as far as the news, which of course we are all listening to, but I encourage all of you to listen to some news maybe at the beginning of the day, maybe at the end of the day, but don't leave that news on all day. It's just a constant stream of talking heads that, depending on what station you're listening to, or what, whether it's a radio or television, and, someone's going to have a different opinion about something, and it can drive all of us crazy. So put on music during the day. Go ahead and exercise during the day. Maintain your distance, but get that fresh air. Get on a schedule. Make sure that you wake up on time, you shower, you get dressed. You always plan your exercise. You're stretching, a few weights and something where you get that heart rate up, even if it's inside your house, and you follow a link. There's so many exercise links on the internet right now. It's incredible. But go to bed on time. Get that scheduled. Just make it predictable. And for those of all of us who are isolated from our loved ones, especially those of you who your loved one may be in a lockdown care facility and they can't come out and you can't visit them. But that doesn't mean that you can't send them a pile of old pictures and get on FaceTime, or you have a copy of the same pile and you look through them one by one and just remember all those cool memories of that time. I was just doing that with my daughter actually yesterday, and it just happened to be when she was a little girl. She's 32 now, and it was just so fun, like reminiscing about, a trip we were on, or where she was when she was 2, or that silly little face she had. But reconnect. We can still connect even though it might be somewhat distant. Telemedicine, teletherapy are available now. It is amazing. Use them. Don't lose touch with your healthcare provider because you don't want to go into the clinic. Most everybody is doing telemedicine now. We've had to, which has been fantastic. It saves the environment. It saves gas. You can do it from the comfort of your home. And again, teletherapy, I can't emphasize enough of how available it is and how fabulous it is. Think about helping others. Volunteer when it's safe to do. Support a local business with a gift to someone, that may not have the money that you have. Reach out to a neighbor. I know on our cul-de-sac, we have 2 cul-de-sacs on our street, and someone just put a note on everyone's house and said, if you want to include your name on this list, go ahead and do that, and then I'll compose a list, and when one of us is going to Costco, we'll send out an email and take a shopping list so we don't all have to traipse in Costco, and just things like that are feel good. Do something for someone other than yourself. It makes all of us feel better. And then find humor, watch some silly old movies, be silly with your grandkids, and go ahead and read them some bedtime stories. It's a great way to stay connected to them at night. And here's a couple of great resources. One I really wanted to point out, for this applies to anyone around the country, is psychologytoday.com. Fabulous. I went on it. And if you want to see someone in person, you just put in your area code, and it will tell you if they accept insurance, if they do telemed, if they see people in person. You like someone that has a blurb written about them and they live across the country, guess what? There is teletherapy, so don't forget that. Then that plug for Southern Caregivers, that's here in Southern California, which is an amazing resource center, a lot for the care partners, which we're going to talk about just for a couple slides, but it is really important. But I never want to forget talking about the care partners through all of this. And we know that there's a tremendous amount of emotional strain for care partners and family members for their patient and their person they love with Parkinson's disease. They get frustrated, depressed, and anxious. Obviously they do. And sometimes that exhibits as feeling extremely fatigued and even angry and just saddened, like, what can I do to make this person motivated? What can I do to get them outside and exercise? I feel like I'm a constant nag, huge burden. And that burden is only worse now with COVID-19, when people are together nonstop. And that care partner stress can show up in a number of different ways. It's not abnormal to just have a burst of tears, and even physical symptoms, aches and pains that just won't go away. just trouble staying focused, staying concentrated on what you want to do, because the stress can create that. You can feel helpless about the future and what is this going to do and how much longer can I do that? And then, of course, there's those horrible feelings of guilt and helplessness. And how, I can't even believe I'm thinking this way when my loved one with Parkinson's, he or she is the one that's suffering. And I feel guilty about my feelings that I'm having right now. But Care Partners' motto, which you do need to repeat every day, you need to take care. Taking care of yourself is really the least selfish thing that you can do for yourself every day, and certainly more difficult to do in the area of the time of COVID right now. Difficult to obviously go out and get a massage. Maybe not now, but hopefully sometime soon. But call a friend, go to a different room, call a friend who knows your spouse with Parkinson's, call a friend who doesn't know anything about Parkinson's. Maybe just get out of that Parkinson's world for a little while. Watch a funny show, watch your favorite show, whether it's a romance or a robber and cop movie or whatever. Of course, exercise. Nothing will make you feel better. Nothing will stimulate that dopamine, that serotonin than exercise. It actually releases more dopamine when you exercise. We know that scientifically. So get out there, get some fresh air and get some exercise, but be safe. Go out in your garden, plant a garden. Tend to your roses. Create something new. Have a project. And take 10 deep breaths. When you feel that stress coming up, there's an app actually on smartwatches now, on iWatches, that actually will remind you throughout the day, it's time to deep breathe. And again, it just, even during a normal work day, it's an important thing to remember to take those deep breaths. Just close your eyes and breathe in and breathe out and release all that anxiety. It will do wonders for your anxiety. And then dealing with mood changes with your person with Parkinson's, you know what? Just try to limit distractions, which isn't too hard to do in this day right now of the pandemic. There are not a lot of distractions, but maybe just give some choices. Today, we're going to get up and we're going to exercise, and then we are going to go in the garden and we're going to pick weeds, and then we're going to go in and we're going to watch that funny movie. Just sometimes it's a really good thing to have more of a schedule and not say, do you want to go out in the garden and plant a garden? Do you want to pull the weeds? Or do you want to buy new rose bushes? Just give one thing. It will simplify life. Activities for your person with Parkinson's is definitely online right now, but there are tons of support groups. I know where you live, and certainly in San Diego, that are just meeting online like we're meeting now. Reach out to those. It's not as good as being in person. It's not as good as hugging somebody, but the words are there. The support is there. So get it, reach out to it. There are a plethora of organizations that are there to help you. We are going to get this. We're going to get through all of this together. I promised you that. So hang in there. And thank you very much. Bye-bye now.
Thank you, Sherrie. You added to your slides to address the current COVID situation. Thank you so much for creating that presentation for us. We are coming up to the end of the program, but we do have some questions, and I made promises. So, okay, I'm going to combine a couple. A lot of people chimed in that what you said about anxiety and the heebie-jeebies, and just where, that the words you use resonated with how people feel. So I think the question I have for you is, when someone is experiencing more anxiety or more stress, someone specifically said that's when their voice gets softer, where they could barely even talk on the phone. Are some of the non-motor symptoms you described, do they also affect
other Parkinson's symptoms?
Yeah, they absolutely can affect other Parkinson's symptoms, 100%. You know, certainly with anxiety, guess what happens? People that are tremor predominant, that tremor is going to get worse. When you're anxious, when you're stressed, that tremor is going to get worse. That speech may get softer. It's true. You may get more rigid. The brain controls our body. And so when the brain is stressed with one of these situations, then it can affect your Parkinson's as a whole. So again, I really encourage you to talk to your healthcare provider about both things. Remember, we talked about it's not just a simple answer. It's identifying that it is a problem that you're experiencing, but then it is addressing that problem with therapy, with medication. Sometimes dopaminergic medication needs to be adjusted. A lot of my patients, when they get that anxiety, it's their sign they're going off. So they can tell between their doses and they start getting that angst. If they take some Ambrosia, they take something that works pretty fast in terms of dopamine, that anxiety will release. Exercise, and none of us here at PMD Alliance, at the Parkinson's Associations, whatever, you're never going to stop hearing that from any of us. Exercise, exercise, exercise. It helps release the good neurotransmitters that will help settle down that anxiety. And sometimes, if those mechanisms don't work, there are some other types of anti-anxiety drugs that I end up prescribing for patients to use as needed. And they just use it PRN, just as needed. When that angst gets so intense, then you can take something that just addresses the anxiety. So there are a lot of ways that we can deal with these problems.
Okay, very good. I'm so sad that it is the end of our scheduled time. Many of the questions have been wanting to hold on to the information you shared and access it again. So we will, after this, everyone who registered will get a follow-up email, and some of those resources that you shared and people couldn't jot them down fast enough, those will be in the follow-up email. So you'll be able to refer to some of the resources Sherrie had on her slides. And I think we have to cut it at that point. But I will say that we have a lot of other online programs for you to join if you like what you saw today. We have about something once a day here at PMD Alliance. So I hate to leave questions unaddressed, but we will be able to, maybe tune into something else and we can get to your questions later. I have one special shout out from Dave in Orange County. He said he was your patient for a long time and loved seeing you, and he moved and doesn't get to anymore. And I think I can see where he's coming from, thank you so much for this presentation. It was a combination of a lot of things, and we started with the presentation on non-motor symptoms, Parkinson's disease, psychosis, those slides prepared by Acadia and sponsored by Acadia. And just again to review the second portion, all of the slides that you had about depression and impulse control disorder and anxiety, those were prepared by Sherrie, and that is, her original material. So just wanted to make sure everyone was clear about that. And thank you for preparing that. Thank you for educating us. Thank you to Shannon for that dance break. I think we used our minds. We learned something, empowered ourselves, used our bodies, got a taste of how dancing can feel in the middle of the day. And I encourage everyone to take that and run with it. Hopefully you leave today and leave this presentation inspired, whether to talk to your physician, check out some of the resources Sherrie shared, or maybe try out some of those dance moves in another forum. But that does wrap our presentation for today. So thank you again. So glad to have everyone join us, and thank you to all my fellow panelists. I appreciate it.
Thank